Hello, this has been a long overdue video, I guess, to give you guys some update. We are today, Thursday, January the 5th, 2012. So it has been more than a year and a half since my last video. This is video 18th. And I felt like I think it was very important to let you guys know where I'm at, how I feel. And the last time we talked about the collective stem cells, and many of you since have been requesting or asking the question about why I did not have the auto transplant yet of my stem cells. Well, I'm happy to report to you that my stem cells are still somewhere in the freezer at Quebec, which is the Quebec version of the Red Cross. Why is this? Well, I will try to explain to you here on this video why the decision of not having gone through the auto stem cell transplant. Today actually is a day where I just came back from my doctor's appointment. I've been seeing him for the last, I would say, year on every second month basis, and now as of today I will be seeing him only on an every 3-month basis. Still getting some blood works, to just for him to keep an eye on me here on a monthly basis, and if need be go in to see him earlier, but otherwise I'll be seeing him on every 3 months. My blood results today, well, this is the first time, I guess, since the diagnostic in December 2008 that all of my blood results are perfect. I'm not anemic. I am my neutrophils are perfect. My red blood cells are good. My white blood cells are good. My platelets here are perfect. So even the B12 that I've been on here will be removed, as I've sort of got a overabundance of B12 vitamins, so I'll be taking off that medication. Ever since the August of 2008, I have been on these following medications. I am still on Revlimid at 25 milligram, with 21 days per 28-day cycle. A 20 milligram once a week, which is usually on Wednesday, that I take the dexamethasone, which is the steroid. And that pill still that dosage still keeps me awake every Wednesday night, so I hardly sleep, or I'll sleep an hour or two on Wednesday. And last night was a good example of that I slept probably half an hour, and here I am still kicking. So the also other pills that I've been taking is it's like an anti-fungus, which is like not an antibiotic, but it's sort of a Mepron, which protects my lungs because of the steroids that I take, and a calcium pill I was taking up to today, a B12, which I won't be taking anymore, and the blood thinners, which is like a red aspirin. And that's the extent of all the pills and treatment that I've been on since the collect. When I was diagnosed at 35 to 36% of plasmacyte, which is the bad, myelomic cells that were in my bone marrow. Today I'm still at about 4 or 5, but according to the last results here, to the blood works here today, I didn't manage to get the result of that marker, but it should be lower than last, which was at about 5.2. So and since following a biopsy that was done about 3 months ago, I'm around 4%, from 36, which is pretty good. And that is without stem cell transplant. And so why the decision? Well, the decision is right now all reports across the world are coming with the new studies that, a combination of different medications. If you are on treatments, you would know what Velcade, which is a first-line usually treatment for any myeloma new patient, and obviously with the Dexa, which is the steroids, and usually followed on with the Revlimid. And for me, the Revlimid has been the most effective treatment. Prior to my stem cell collect, the treatment was mixed with the Velcade and also with the high dose of steroids. And that brought me down to 2.8 before collect. So I have a pretty good collect on hand. And right now, many of you have been asking me for, question, what do I do? My dad's feeling that way, my wife, my brother, or myself, what do I do? It is very difficult to look at, information and for you to try to understand what all this. Well, multiple myeloma is still an incurable disease. Let's just not go crazy about this. But the last 3 years, the steps in the therapy that have been sort of keeping people alive here. I am a living proof of that. It's 3 years in the treatment here. I am not in remission. I am at about, about a level of 4 to 5% of plasmacyte in my body, which is very good. They're not affecting me. They're not bothering me. And the medication that I do take, keep me functioning normally. I still work full time. I still enjoy life as fully as I can. The last X-rays here showed that my bone had almost recovered all of the small little, perforation that multiple myeloma will usually cause the bone. So the prognostics of life expectancy. When I was diagnosed, and I remember reading, all over the internet, and from the Canadian Cancer Society, that when you are at a stage 3A, which was my case here with multiple myeloma, life expectancy was 24 to 36 months. Well, today with the new therapy, the Velcade and the Revlimid, that's all changed. Today we can expect 5, 10, maybe 15. The results are in only from the last 5 to 5 years in these new medications, because they've only been out on the market for 3 years, and already that the results of those studies are saying that life expectancy should probably be well over 10 to 15 years. The idea, I guess, of the new medication is to try to avoid, the serious, the stem cell, the auto transplant, which could be, very difficult for some to undergo, and especially if you're 65 years or older, you're not even eligible for that auto transplant. So, but the new medications today, according to the last studies that I read about a month ago here, coming from the ASH, which is the American Society of Hematologists, that they have meetings on it every year, and new research, results are in. And right now the research are in with the new version of the Revlimid and a new version of the Velcade, that we can actually go into remission, because they have one of the latest study here that, out of 55 patients, that 98% of all patients after a 12-month therapy of only these 2 and 3 medication mixed have gone into remission without stem cells transplant. So, and then if you don't forget that, if you have not had the auto transplant, you still have a chance, and you're still eligible for it, even if you have many years of dosage of other medications. So for me, the idea is to keep the stem cells in the freezer until absolutely necessary, when I will not be responding to the current therapy. Well, we can try a different therapy by mixing other pills, because that's what it seems to be. AIDS today is treated that way. When they thought only one single treatment would cure someone with AIDS, that never happened. But when they start mixing the different pills and different agents, and that's when today you don't actually die of AIDS. You will die from complication from anything else but AIDS. But the idea today is that the pills, which is only at its second or third generation of new pills, is increasing, the life expectancy, because they're becoming more pointy about where it's affecting and where it's actually killing what it's supposed to do. Because in the general chemotherapy, you can't forget that, you're not just destroying the good, you destroy the bad, you're destroying the good ones. And that's where it gets complicated. That's when people would get kidney problems and liver and so on, because you can't. The standard chemotherapy is a I call it, the like George Bush was calling it, the arm of massive destruction. Where today they are a lot more targeted pills and regimens. So for me, there is absolutely no hurry to actually go and mess up my my immune system, my stem cells, from getting this total destruction of your bone marrow with the auto transplant. So that's where I'm at with this. So the jury for me is still out, because there's still a lot of opportunity to combat and fight against this multiple myeloma. Even though that I'm not in remission, I am absolutely in great shape, no anemia, my kidneys are functioning very well, my liver, my calcium, my bones, everything is fine. The only thing that's bugging me is basically the occasional diarrhea that I will have, and that's probably caused from a mix of the Mepron, which is the like the antibiotics that I take, which probably once in a while ruins my intestinal flora, so I have to redo that, with yogurts and so on, but definitely not a suffering. So where I'm at right now, a lot of you have been asking me, what do I do with my dad? Is that the pills that's doing that, or is it my wife, my sister? I've lost my mother, I lost my brother, I lost my dad. Multiple myeloma is a cancer that will react and then fight in anybody's body in a different way. It depends on your age, depends on the type of myeloma that you have. If you have chromosome 13, if you have any signs of a very combative multiple myeloma, it is important that you understand the type of multiple myeloma that you have, and only your doctor, by asking the question, by reading, because asking a question is one thing, but you actually understand the answer, and that is not the easy thing. The only way you can do that is go through. There's one very, very good website that I like to go to. It's the Multiple Myeloma, Research Foundation, which is the MMRF. It's based in the U.S. and it's a research foundation that was founded by a very nice lady who has, at 37 years old, was diagnosed with multiple myeloma. Ever since, she's had the auto transplant and also had the allogenic transplant, which was from her identical twin sister. And but for her cancer was dormant 3 or 4 years. So most of the people that actually work on this research foundation are actually people who live with multiple myeloma. So you can imagine, when they go and sit at a table with a pharmaceutical company or a research center, they want results. And they don't want results in 2 years, 3 years, 4 years from now. They want results now. Because when you are suffering from a cancer of this type, you don't want to be told that maybe in 10, 15, or 20 years we'll have the cure for it. But what's happening in the meantime? Well, what's happening in the meantime with multiple myeloma? We may not be at the cure yet, but I think we're getting very close. But we want right now some hope that we can actually live until they do discover the cure, or at least we can control. And right now, I think the consensus with a lot of researchers and the experts in this field are saying that if we can't cure it now, can we control it? And just as to treat multiple myeloma like a chronic disease. Well, if diabetes, diabetic people can be controlled with pills, for the insufficiency of insulin, because their pancreas does not produce the insulin required to maintain, their sugar level at a decent rate. Why can't we do that with a disease, with any other disease? So is it important to cure it, or is it more important to control it? Well, if I have a chance to control it and live 15, 20, or 30 years from now, let's control it. But the risk associated with auto transplant and so on is the destruction of your bone marrow,
and you're never the same from that day on. You will not regain, 100% of your bone marrow. So, and then the studies about 6 months ago were saying that they weren't sure about if auto transplant would be good at the beginning of the treatments or somewhere down the road when you only need it. So the jury was out on that one too. And right now, with the new regimen of pills, they're saying that we're not sure even actually that, auto transplant is actually required. If we can bring you into remission without the auto transplant, well, that's perfect. But still have the opportunity that if you're not responding to medication, that the auto transplant is there as a last resort. I know some hospitals, especially here in the province of Quebec, still perform a lot of the allo transplant, believing that that is the only way to cure multiple myeloma. Well, let me tell you that anyone that has gone through these transplants have not cured multiple myeloma. It may be just postpone something that's, inevitable. But if you are, well controlled with medication, you should stick to controlled medication. But that is something that you have to discuss with the doctor in understanding the disease and what these treatments will do for you, and understanding also what kind of quality of life do you want from here on. I was 47 years old when I was diagnosed with multiple myeloma. People a lot younger than me were diagnosed with multiple myeloma, but when you're told that less than 5% of all multiple myeloma sufferers are less than 50 years old, it's a big thing. That means maybe here in Canada, we're talking about maybe a handful of people, maybe 100, 150 people with the new diagnosed people under the age of 50 will suffer from multiple myeloma. That's a very small number. And it's not, would you rather to have a disease that a lot of people have because that's where the research and the money is, and the understanding and the knowledge of the disease? Or would you prefer to have something that is so rare that only few doctors have ever heard? My family doctor had never heard of multiple myeloma in 30 some years of her career. So when you are diagnosed at the beginning, the importance is to get the right doctor to look after you. How do you know that? Well, is by understanding and knowing about what is multiple myeloma and what is being done right now to treat multiple myeloma. Only then you can ask the doctor, what do you know about this? How are you going to do this? If you don't ask those questions, you're going blindly and letting his knowledge, which may be limited. And that's why, if you are going to be treated with multiple myeloma, I suggest and I strongly recommend that you go to university hospitals, or that you go into at least a large hospital center, which, specialized hematologists will understand what is multiple myeloma. Likely they will know how to treat you, but all doctors are equal. I once told someone, that it's not because you have a doctor's degree that makes you a good doctor. Just the same as you can say a driver's license does not make you a good driver. You must ask the question. You must feel okay that he's going to take the time to see you whenever you need. He's going to take the time to answer your question and tell you what you need to know. And that is communication. A lot of people here have been surprised for the last 3 years that a lot of people have called me on behalf of their wives or on behalf of their mother or somebody else because that person did not want to hear something bad. Well, opposite of what I would like to do, you tell me the news so that I can decide how I'm going to act and how I'm going to choose my treatments from now on. If I know that the treatments that I have are insufficient or not good for what I need to do, like the stem cell transplant would probably mean that I'll be out on my, for 3 to 4 months. I really can't afford to do that right now. I run my own company. I need to be alert. I need to be there. So I don't need that. And do I want to go spend 3, 4, or 5 months if there's no complication? Because an auto transplant is very, very, very difficult. They first, give you a very high, after they've collected your stem cells, of course, they give you a high treatment of chemotherapy to destroy the entire bone marrow that you have. That means you have no more white cells, you have no more platelets, you have nothing. You have been destroyed. And that's usually a day after, then they reintroduce the blood or the stem cells that they've collected previously. And if there is a good collect, well, it may take a week for you to start, pumping those numbers back up, your white, your red, and your platelets and so on. And then, but during that time, you are exposed. You are exposed to, infection. You are exposed to maybe something happening at the hospital. And we know today that hospitals are filled with bacteria. So we have to always worried about, how we will react to this. And if you pass the stage of 1 week, 2 weeks, some people get out, after 2 or 3 weeks of that intervention, and some people will be there for 6 weeks. But after that, it's a slow process because your bone marrow must rebuild itself. And I know it's difficult for me to speak to you with, and I'm not because I'm saying that I'm against the auto transplant. If you feel that is the only way you can cure mentally your multiple myeloma, you better get the auto transplant. But if you believe that medicine today is at where it's at, we're not drilling holes in people's head now to relieve headaches like they used to 150 years ago. We are at the stage where medication, pills, chemicals, and name it, whatever you call pharmaceutical, are there. In the next 10 years, there's going to be a total revolution in how cancers of all sorts are going to be treated. And instead of being, maybe at the hospital for 6, 7, 8, 10-hour treatments with high dosage of chemotherapy, which is horrible, destroys your entire system. People go anemic, they get blood, they get, blood transfusion because they're anemic. And then from every complication that follows that, how can you destroy someone completely and not open the door for anything else? Side effects, other disease, other cancers. When you're flat on your butt, I can tell you that you will probably be exposed to everything that's out there. Well, if they can, with regimen of pills, target your type of cancer, that be a breast cancer, that be, an intestinal cancer. Cancer is a growth of bad cells. That's what needs to be stopped or reversed. When your body is strong enough to fight it, some people have been talking, I've been reading so many things about cancer, the miracle cured people that, they've had one cancer and then a second time they got another cancer, started treatment and then stopped all treatment and the cancer went away. Why is that? How can that happen? Well, our system, our immune system is designed to fight against that. So we must not destroy it. We must reinforce it. How do you reinforce your immune system if you're giving chemotherapy to destroy it? So that's where the new regimen of pills will be probably very important. The research are there. They're starting to more and more try into the treatments here to introduce pills, because the pills it's a cleaner way to fight cancer. It's a non chemotherapy style of cancer. So this is being introduced in many other cancers, and right now with the type of cancer that I have, that I'm concerned with, multiple myeloma, I can tell you that it's working. So if I gotta recommend anyone a type of treatment that you must choose the one that fits your needs. The one, if you want to be able to walk around, to still enjoy life. And then again, we have to be careful when I say that, because if you are going in with a diagnosis of multiple myeloma with bone problems, with, your discs are collapsing, and then you're already suffering from quadriplegic in a wheelchair, well, I don't think chemotherapy, nothing will help anyway. What needs to happen first is they need to control the multiplication of the cell in multiple myeloma. And that is the first course of action. The rest after that is to how to repair the damage that was done by multiple myeloma. So by taking care of the growth of your multiple myeloma or the myelomic cells, that's the first thing that they need to do. That will sort of give relief on your kidneys if it's not too late. So the doctor that you will have, that you should choose, is a doctor that will be willing to answer the questions and tell you straight out what he knows and how he intends to treat you. And today, if you read a lot of stuff out of Europe and in the Mayo clinics in the U.S. and a lot of the expert, cancer clinics across Canada, U.S. or Europe, you will see that they're now coming to a consensus in the next year that they may actually take this auto transplant off the table and bring you into remission with standard regimen of Velcade or which is bortezomib, Revlimid, and the cousins of these pills, which is carfilzomib, and then a mix of 2, 3, or cyclophosphamide, which is another treatment. So all of these things, don't be surprised if you're being exposed to saying that you will be 2, 3, 4 different pills that it may take to cure your multiple myeloma. And once you're into remission, the doctor must decide now how to wean you out of these pills without abandoning you. Because it's not because you're in remission that you have no chance of you relapsing into multiple myeloma. So how do they prevent that? Your doctor, from any surgery or from if you've had the stem cell transplant, many doctors just stop treatments totally, and that's wrong. Because the only thing that will extend the overall survival of the patient, or at least before it reoccurs, you must continue to treat. Continue to treat even if you're at 0. And it's usually that the favorite pill for that is Revlimid. You may start with the 25 milligram regimen for 6 months, even if you're at 0. They want to make sure that it's not reoccurring, and it's not because they're not detecting it in your blood that it doesn't mean it has a little bit of it still. So the 25 milligram at least for 6 months, and after that they will lower the dosage. Usually would go from 25 to 15 for another 6 months, and another from 6 months of that, and then you go to 10 for 6 months, and go to 5 for 6 months, and then the doctor may decide to wean you out after 6 months and just follow you up. So it's not something where you get the surgery or get a high dosage of pill for 6 months and you've gone home and don't call me. It has to be. This is not the battle has not been won on this cancer, so they must be careful. And I would rather have too many pills for a year that actually made sure that my remission is gonna be staying for a while, than the doctor taking me out too fast, and then 6 months or 12 months down the road, I go back again to square one. So the best way to do it is communicating with the doctor and to inform yourself. Today, the beauty of internet, it can be used to play, to go on Facebook, or it could be actually there to educate yourself. And educate yourself takes the fear, takes the anguish, takes the anger. Many people that I've left messages that I've talked to here in the past 3 years, it's unbelievable. We all go through that. We all go through these phases, from the diagnostic is denial. How can that happen to me? It's impossible. And then the anger. Why is this happening to me? Why is it not happening to Joe there? Has been smoking all his life, never looked after himself, doesn't exercise. The anger. Why is it happening to us? The depression. Now it's sinking in. What am I going to do? What's next? I don't know anything about this disease. There is no support group. And if there are no support groups in your area, I suggest you start one. Because the more people like you that you will meet, you will encourage each other, because you may find someone in that group that's been living for the last 10 years. That's good news. That's what I was looking for when I started this little support group here in our area. I want to find people that have survived it. And What do they know about this pill? What do they know about this treatment? How did that make them feel? How did their family react? How do they react? Because when you don't look sick on the outside, like I do, nobody feels sorry for you. It's not like you're coming home with hoses and everything, tubes coming out of your nose and in your stomach and everything. What I wear is this to remind me that I have multiple myeloma. But I don't feel sick. And if I don't feel sick, I am not sick. I can enjoy life fully. And the next step, the fastest step that we have to go through is acceptance. Accepting the fact that we will probably have to live with multiple myeloma for many years or maybe for the rest of my life. But so will diabetic people. So why should I be different? But I should change. You should change. You should change by looking at life differently. Life is fragile. But what can I do? I can't control. The doctor can take care of my multiple myeloma. But I must take care of the health that's going here. This is where it's important to keep healthy. Stay positive. I don't wake up in the morning anymore to say, oh, today's probably my last day. How many years do I have to have? I remember a video that I posted a few years ago. I wasn't even sure if I was going to turn 50. Well, September 27 came around in 2011, and I turned 50. I wasn't even sure that I was going to be celebrating my 25th wedding anniversary. Well, on September 5th of this year, of 2012, I will be celebrating my 25th anniversary. And then this summer, I plan on RVing around, Western Canada. I will not wait anymore. I changed my priorities. If we have money to do this, I took 2 vacations this year. I went to Jamaica in March, and I went to Jamaica in November. And next spring, I tend to take another little trip somewhere down south. Why not? Why not? What's holding me? I said to someone one day, says, how would you rather die? Even if you die at 80 years old or 90 or whatever. Would you rather die rich or would you rather die poor? Well, dying rich means you've done nothing. Dying poor, you may have exhausted everything that you've earned, and that's how life should be. There is going to be enough insurance around to take care of people, but you must not take everything for granted because we just don't know. Today is multiple myeloma. I could, easily die in a car accident. I could easily die of anything else. So am I going to wait? I'm 50 years old. Do I want to wait till I'm 55 to really enjoy it? Or can I enjoy it a little bit now? I would probably rather have a little bit of enjoyment every year or every day than to wait for the big bang here in 55 when I'm 55 or 60 or when I win the lotto. That may not happen. I won this lottery here, which was called multiple myeloma. May not be the most grateful person in the world here to say yay, but I take it as an opportunity to change my life. Because today you can stop, you can sit around, feel sorry for yourself, or you can just take it as a nudge to look after yourself. I've posted many times here on my Facebook and my multiple myeloma account here, that we have to stop dreaming our life. We have to start living our dreams. The bucket list is full. If I do half of it, great. If I just do 10 of them, I'll be happy. But a plan stays a plan until it's into action. In the last 2 years, if I took you around this house here and showed you how many renovations I did, why? I wouldn't have never done it, but I felt that it was the right thing to do. I wasn't going to wait around for things to be perfect when I'm going to be not sick, when I'm not going to have this, when I'm going to have all the money together. Why? Put a plan together, execute it, you're in action. If that means buy yourself a tent trailer to go spend, a couple of weeks in Yellowstone, well, do it. Do what pleases you. Do the things that you probably would have postponed a long time. If you feel like going back to work, go back to work. It changes your mind. If you can't, for a health reason or whatever, or the condition that you're in, the treatments or whatever, go back to a little bit of something. Go back to a little bit. You don't have to be working 7 days a week. You could go find yourself a little job a couple of days a week just to get your mind off this. And that is when the mind is occupied. It leaves no room for what's wrong with the rest of the world. Let's put it that way. In the last 3 years, it's sad, but we've all been living through this terrible economy. I would know that. I own a small manufacturer here, where we used to employ about 25 people, and now we're employing barely, 15 people. So this economy has touched us. I could have sat around and say, well, here I am, sick, the economy is not right. Well, I'll do what I can to survive. I'll do what I can. I'm a fighter. But I stopped fighting multiple myeloma. My doctor takes care of that. I fight to stay focused. That's what I try to do. And that's the best advice I can tell anyone. You have to do what makes you happy. And if that means that has limits, well, I'm not going to stop. I'm not going to sit here and cry over the things that I can't do, because that would be defeating the purpose of trying to stay positive. When I get up in the morning and I see that it's raining, well, I don't say, oh, geez, it's not sunny. It's raining today. I accept it. Accept what life gives you. And don't cry over the things you don't have. Enjoy the things that you have. If you lose an arm, well, you still have one. If you lose both arms, you can cry all you want. They're not going to regrow. So you might as well accept the fact that you may have to change something. So if you can't change the situation, you better change your attitude towards it. I'm going to leave you with this here. And I do enjoy, leaving these little videos here. I know it's not a science video that I want to do, but I wanted to give some people, some encouragement so that they can see that there's hope out there, that, we're not a lost cause anymore. Like probably 5 years, 6 or 10 years, the people that were diagnosed with this terrible multiple myeloma 10 years ago had no chance. But today, if you're still alive, that is good news, because the odds are on our side for a change. New medication, new treatments, and a good doctor, and I insist, a good doctor. Move away from the doctor if he does not give you the time of day, if he does not answer your question, or every time you see him, he's not there. The doctor I have is extraordinary. I send him an email, he responds. I send him a link of things that I see on the research foundation somewhere. I send him the link, he responds and what he thinks. And when I meet this doctor, now it'll be every 3 months, I can spend a good 15, 20, 25 minutes of my time to really discuss what it's all about. What should I do? What he thinks. That doesn't mean that I have to make the decision right away. I can take into consideration what he's telling me and decide for myself what's best for me. The day we take our cancer, we take ownership of our cancer. It takes the fear away from suffering or living with cancer. I would rather be able to be a partner to my treating doctor than to be his patient without knowing what is next. I know what is next. And right now there's hope. There is survival. And all I wish for all of you in 2012 is health, but especially acceptance. Change what you can't. Change your attitude towards what you can't change. And with this, I say to you, Happy New Year and health for everyone. Thank you for taking the time to listen to me. But don't forget, my email will follow then at the end. If you wish to send me an email,
I will definitely respond. I may not respond the same day, but I will take the time to respond. If you leave a comments on my videos, do, and it will be a pleasure for me to respond to you. So to all of you, thank you, and talk to you next time.